Good day. I'm Dr. Vani Sundarapandian from Jananam Fertility Centre, Chennai. Many of you have a lot of questions around some of the barriers to fertility. In today's Q&A session, I will try to answer the most common questions. While age is not an absolute barrier to conception, as women get older, conception becomes more difficult. Fertility naturally starts to decline in the 20s. After age 35, fertility decreases rapidly. A woman is typically born with a finite number of eggs. With time, the supply diminishes. The remaining eggs age along with the rest of the body, as do the change in hormone levels. In some cases, this can cause irregular ovulation. Age also impacts male fertility. As men age, their testosterone levels naturally decline, and in turn, their sex drive may wane. The quality of a man's semen also drops with age. Despite this fact, men continue to produce sperm for their entire lives. Women should not self-medicate. Couples suspecting a fertility problem should consult their gynecologist early. When it comes to infertility, both male and female have an equal chance to face fertility issues. In fact, roughly 1/3 of the causes of infertility are due to male-related issues and 1/3 due to female-related issues. For the remaining third, the cause can be the result of problems in both partners or is unexplained. Smokers are more likely to have fertility problems than non-smokers, no matter the type of cigarettes. Men who smoke not only have poorer semen quality than non-smokers, but also suffer from a lower sex drive. The more you smoke, the more your risk for fertility problems is increased. Female smokers that suffer from fertility issues may also tend to take longer to successfully conceive, even after seeking fertility treatments. Secondhand smoke exposes you to poisonous chemicals, affecting your fertility. In fact, secondhand smoke is almost as dangerous to your fertility as if you were smoking yourself. Exposure to cigarette smoke for even just a few days can affect your health and your fertility. Being overweight or obese may reduce a woman's fertility. A body mass index of 25 to 29.9 is considered overweight, while a BMI of 30 or higher is considered as obese. In fact, a woman who is overweight by 13 kilograms and above may not be able to conceive easily. For women who are obese, weight loss of 5% to 10% may dramatically improve ovulation and pregnancy rates. On the other hand, being underweight can also impact your fertility. If I get my period regularly, does that mean I'm ovulating and fertile? For the vast majority of women, regular periods is a sign that the individual is ovulating normally. On the flip side, the lack of a period is definitely a sign that you may not be ovulating. However, it is also possible to get a period every month in which you do not ovulate. However, regular ovulation is not a sign for fertility. Conditions such as tubal blockage or low progesterone levels are examples of barriers to fertility, even though the individual may still be ovulating. Stress is often a common cause of infertility. The chemical imbalance caused in our bodies due to excessive stress often has a negative impact on the ability to conceive. There is no one best way to reduce stress. However, some tips to help control the stress levels on an everyday basis include: 1. Changing how you react to stressful situations. Having a calmer approach to stressful situations often affects significantly the chemical reactions that occur in the body and may contribute to a conducive condition for the body to be impregnated. Number 2, taking up an activity or changing your lifestyle to reduce stress, such as getting enough sleep, exercising regularly, meditation, practicing yoga, counseling, reading a book, just doing what you deem as calming. Self-medication is not advised as a method to overcome fertility issues, especially when the individual does not know what may be the cause for his or her fertility woes. Consulting a fertility specialist can help identify the condition that an individual or couple may be facing and to receive the appropriate treatment to help you conceive. A healthy diet and lifestyle is definitely one of the best ways to reduce any negative effects on the body that may cause infertility. However, maintaining a healthy lifestyle and diet does not increase your chances of conceiving if you have an existing fertility issue that is not related to diet, weight, or lifestyle. The recommended course of action if you suspect that you have a fertility issue is to seek help from a fertility specialist as soon as possible. Without consulting a medical professional, an individual may not be able to identify the cause for his or her fertility woes. Consulting a fertility specialist can help identify the condition that an individual or couple may be